Move that out of the way. All right, perfect. So I am Michelle Chappell. I am the training coordinator here at the state, and I am moving all these things out of my way. I am joined today with Amy from the Water Wellness Program, as well as Lou and Hannah from the state. But I will let them all introduce themselves, and then Amy will get us all going. I believe there is an opportunity at the end for questions. So if you have questions, we can do those then, and I can always stop the recording if you prefer to come off mute for those questions or on camera. But I will mute myself, and Amy, I will let you take it away.
Sounds good. I'm going to bring up a presentation. Can everyone see the slide? Okay, Michelle's nodding. So my name is Amy Hudnor. I'm from the New Hampshire Department of Environmental Services, and I manage the New Hampshire Water Wellness Program in addition to Dr. Lou Barinelli and Hannah Scott. Lou, do you want to introduce yourself?
Sure. Thanks, Amy and Michelle. Lou Barinelli, I manage the water analysis lab here at the Public Health Lab. This is where the samples that are submitted from the WIC program come, and we do the analysis and send out the reports back to Amy, and there's notifications and filter picture options for those participants who qualify. Just a little bit of quick background. I've been at the water lab for just about 27 years now. So glad to be here, and thanks for having me. I don't know who's next.
And Hannah, can you introduce yourself?
Sure. Hi, everyone. I think I've had the chance to meet everyone that's on this that I've noticed. But if not, my name's Hannah Scott. I'm with WIC. I'm the nutrition coordinator here at the state. So good to see so many on this training today.
And I have a quick question. For those of you, I'm never sure if the screen that I'm seeing is the same as what your screen. So are you seeing just a slide? Are you seeing like double faces or anything like that? Anything strange?
Or it looks good.
It looks good. Okay.
It's just your cover slide.
Okay, good. All right, so today for you all, we're going to go over, we're going to talk about the difference between private wells and public water systems, and why are we focusing on private wells here with this program. We're going to talk about the common New Hampshire well water contaminants and their potential health impacts. We'll go over how to determine if the WIC participants are eligible for New Hampshire Water Wellness, and then we'll talk about how to enroll participants, and then do questions and answers. So for New Hampshire overall, you see on the left, in New Hampshire, about 45% of people are on private wells for their drinking water source, whereas 55%, the little bit of the majority are on a public water system. And as we rolled out this New Hampshire Water Wellness Program over the last few years, we discovered that for WIC participants, it's more like about 16% are on private wells. So we're just a bit different in this population than the state overall, and that many more folks are on public water systems. And we're focused on private well owners because first of all, we know that contaminants are common, whether in well water, whether it's a public water system or a private well that's pulling well water. There are a lot of things in the rock and soil that are just naturally there that have been found to have negative health effects. And public water systems are testing for these things regularly and removing them if they're above health limits. So for public water systems, they're required by US and New Hampshire law to basically make sure that their water is safe for their customers. I'm just showing a picture of about a third of the staff here at DES, Drinking Water Bureau, there's more than what's shown in this picture, but they are focused on assisting public water systems, giving them grants, enforcement, making sure that they're doing their required water testing and doing their required treatment and removal if any contaminants are above health limits. So there's quite an infrastructure in place to make sure that public water systems are meeting those safety standards. With private wells, there's no requirement for water testing or water treatment. And there are things that can be in the well water we'll talk about a little more later. But many private well owners do not even realize this. They don't know that there's potential for harmful contaminants, especially the naturally occurring ones. So that's why we're trying to get out the word, and programs like New Hampshire Water Wellness are focused on private well owners. So I'm going to give you a little information about how to tell if someone is on a public water system versus a private well, particularly if you're a renter, which could be a little more tricky. But don't feel like you have to memorize this, because we also have a tool to help you look up private wells versus public water by address. So I'll show you that in a moment as well. But basically, a public water system is if there's a grouping of homes in an area that have at least 15 service connections, or in other words, 15 apartments, 15 homes, etc., or at least 25 people, they become a public water system. So some of us, like I live in Concord, we're on a big municipal system like the city of Concord. So that's where I'm at home, and also at the office. We're all on this big public water system. But if you're in an area where you're not on one of those big municipal systems, but you're in a housing complex, like a condo, mobile home park, a grouping of houses that are all in the same water system, they become a public water system and they become regulated. So for a private well, you have people that are, homeowners. They've got one of these, wellheads sticking out of their yard, and they're on their own well. So that would be an easily identifiable private well owner. Sometimes homes share a well. So you might have 3 or 4 or 2, homes sharing a well. And it's not regulated until it bumps up to 15 residents sharing a well. So you're on a private well if you're just sharing a well with a neighbor or 2 or 3 neighbors. Renters can be on private unregulated wells, and I'll tell you how to tell the difference. So if you're a renter and you're on a private unregulated well, it's likely that you're outside the boundaries of a big city system like City of Concord, and your landlord or your rental property is not regulated because it's less than 15 apartments or less than 25 people. So let's just say, for example, these 2 photos were both outside of a large municipal water system. The one on the top would become its own public water system because of the numbers. And then the one below it would be on a private well. Let's say you had 4 or 5 units sharing a well, they would be still a private well. So that's how you kind of tell the difference. And in a couple minutes, I'll show you our web tool to help easily, quick and easy figure out if someone's on a private well. But right now I'm going to pass it over to Dr. Lou Barinelli, and he's going to talk about some of the contaminants that we are testing for in this project and what are their health effects.
Thanks, Amy. The first one, as Amy mentioned earlier, most of these contaminants that we're going to talk about are naturally occurring here in New Hampshire, like arsenic, based on the geology here in the state. And some of them, or most of them also, we think of them as posing a chronic health effect, except for, in some cases, relative to children and pregnant moms. And so arsenic, you can see this pictograph for arsenic. at levels greater than 5 parts per billion. That's the safe drinking water standard for public water systems here in New Hampshire. But we also use that value when it comes to private wells or unregulated wells. And so you can see in the pictograph for infants, arsenic poses increased lifetime risk for cancer, increased lifetime risk for respiratory disease, and it also lowers or IQ and brain development in infants. For pregnant moms, lowers fetal growth and birth weight, and can lower early immune system functions for the baby. And we also know that even small doses of arsenic for a short period of time have these negative health impacts for infants and moms. Next one. So lead is not normally found in the groundwater here in New Hampshire, but because of the properties of well water, it can cause lead to be leached out of the plumbing in someone's home from the lead solder or the fixtures within the home, like the faucets. And we know that there is no safe level of lead for children. But again, the pictograph shows some health related risks. So even at 5 parts per billion, you have increased behavioral problems, difficulty in learning, lower IQ and brain development for infants, and for pregnant moms, increased risk of miscarriage or, some neurological development issues for the fetus. So again, no safe level of lead for infants. For the general population, you see up on the top half of the slide, again, it poses, health risks for adults as well at high levels. Next one. Manganese is a naturally occurring element or contaminant here in New Hampshire, and it is essential to have some manganese, but at high levels, it can pose a health risk to, again, infants particularly. So at greater than 100 parts per billion, again, lower IQ and brain development, some neurological development issues. What we're doing right now is if there's a manganese level greater than 100 parts per billion, we are making a phone call to the homeowner of a private well and treating it as an acute contaminant, like you would for something like E. coli or a nitrate or a nitrite result that's above the drinking water standard. Even though the 100 parts per billion is not an enforceable value, whether it's for a public water system or not, we are making the phone call to the homeowners to see if they do have an infant in the home. And if they do, we're recommending that they don't use that water to make formula or cereal for the infant. And again, at higher levels, over a long period of time, manganese does pose a health risk for the general population. I think there's one more, Amy. Last one, I think, is uranium. Again, another naturally occurring contaminant here in New Hampshire. Uranium, I think, mimics calcium, so it can be accumulate in the bones in your body, and this can have prolonged adverse health effects for the general population. Again, lower kidney functions and risk for cancers in both the general population and infants or children. So I think that's the ones we're covering, right, Amy?
Yes. Yeah.
Okay. And then I don't know who's next.
I'm next, and I'm going to quickly open up a web tool. So it's going to take, well, I won't be able to do it quickly. So it's a little slow in loading, but so I'm going to talk about a couple of the contaminants that are geology-based, arsenic and arsenic and uranium, and I'm going to show you my colleague who works on GIS. He pulled together this tool for me to look at how uranium and arsenic are, the likelihood of them appearing in different parts of the state. So I'm going to show that to you all. It just takes a minute to load the tool. But yeah, the U.S. Geological Service, they developed these probability maps of uranium and of arsenic. And I'll show you, just have you take a look. Okay, so right now, what should be, this is showing probability of uranium detectable in the groundwater. So as you can see in the example of uranium, you have some parts of the southern New Hampshire that show up as a little higher likelihood, but for the most part, as we move north, and particularly kind of in the White Mountains area and the kind of Bath, Haverhill area over here, and then also way up at the top, Pittsburgh, and these areas over to the east show higher probability than other parts of the state. It's really a lot of the state, though, right? So, unfortunately. Then underneath there, I'll check off and we'll see arsenic. So arsenic shows up in higher likelihood in the southeast, especially the seacoast area, and then southern New Hampshire, as well as some of central New Hampshire shows higher probability of arsenic. Actually, I should turn on the town names so you can see them. Let's see. Okay, so down here in Nashua, although Nashua is mostly on public water, but some of these other towns, like I think this is Hollis, I think there are a lot of private wells in Hollis, and they have higher probability of arsenic, as well as over here on the seacoast. You've got a mix of public and private water and high probability of arsenic. Bow, Pembroke, Epsom, Ware, Hillsborough, just some areas that are higher probability. But really, in the end, it's important to promote this project statewide because, like, you know, if you don't have arsenic, you may have uranium, lead and copper. Those are coming from plumbing. So really, we want, you know, ideally coverage of the whole state in this program. Okay, so let me go to the next slide. Okay, so I'm going to talk a little bit about how the project is structured and how to enroll people. So currently it's a free opportunity for WIC participants who are pregnant and get their water from private wells. What happens is after they sign up, they get a test kit and then they fill it and send it to the lab, and they get their results for arsenic, uranium, lead, manganese, and copper. And I send them an email and also a paper letter. And if they have any contaminant above the infant health limit, I send them a 0 water pitcher and filter replacements. So 0 water pitchers remove all 5 of those contaminants. So the process works when pregnant participants are coming in for their visit, which I forget. I'll let Hannah remind you all of the name of that visit because it's not coming to mind. Certified, I think, certified.
There's certification.
Certification, okay, it was escaping me. So you want to introduce the water wellness program during that visit and ask her if her water comes from a private well. And most people know right away, especially if you live in a home with a well in the front yard or the backyard. But if she's unsure, we have a web tool to look it up fairly quickly. So this is what the web tool looks like. When you first open it, you get this little pop-up just explaining how it works. Click on close, and then you type in her address over here on the left. And this was what will happen if the address is on a public water system. It'll show up in blue, and it'll say over on the left what is, what public water system is on this address on. If she's on a private well, there will be no color blue, and it'll show, it'll say over on the left that, she's on a private well, and please encourage her to sign up for water wellness. And there's a link to the web map right here in the slides. And I'll also mention, before this meeting is over today, I'm going to, put in the chat 3 documents. One is this presentation. So you'll have it, and you'll have this link. And then there's also a 1-page, or I think 2-page instructions. I'll put that in the chat. And then a little promotional flyer. Okay, and I'll hand it over to Hannah to talk about the process from here.
So this is just kind of walking you through what it'll look like during a WIC visit. And I just wanted to point out, so we mentioned during a certification appointment, but certainly if you notice at a later appointment that the pregnant woman wasn't screened, you can still offer it at a later appointment too. So don't feel like you're only limited to that certification visit. That's just the target, because sooner would certainly be better than later. So once you've identified that she uses a private well and that she wants to participate, she's interested, you'll have her sign a consent form, and then you'll file those in your office. You'll then hand her the water sample kit, and this includes the bottle that she'll need to fill from the kitchen faucet, a form that she'll need to fill out and put back in the envelope with that sample. And then it's a prepaid envelope, so it already has the postage. She can just drop it in the mailbox after that. Next slide. As far as documentation and Starlink, so for every pregnant participant that you screen, you're going to document in the referral screen. So if she has a private well, but she declines, she's not interested in this, you would choose HAS for the Water Well-ness Initiative in that screen. Then if she has a private well and wants to participate, you'd choose the referred option. But if she has public water, so she's not eligible, you would choose NA. So just showing you how there's an option for each pregnant participant that you screen. You're still going to document in there.
Thank you. So I just thought I'd give you a summary of where we're at in 2024. I crunched the numbers to see how many folks were served. So from January through December 2024, we had about 120 moms given the water sample kits and certified or registered in the program. Out of those, we had 43 that collected the water samples and sent them to the lab. And then of those, we had 15 had contaminants above a health limit. So I sent them a pitcher and 4 filters. Some of the highest values I thought I'd show you just to show the impact we can make here. For arsenic, we had one mom with 33 parts per billion when the health limit is 5 parts per billion, so significantly higher. So she got a pitcher and filters. We had for lead, we had one mom with 22 parts per billion. So very high. Really, with lead, I send them a pitcher if it's detected at all. So if it's 1 part per billion, they'll get a pitcher. Then with the manganese, we had one mom with 628 parts per billion, with 100 being the limit. So sometimes we do get very high levels. So these pitchers make a big impact. And thought we'd set a goal for 2025 to get up from 30% to 50% if we can, to get 50% of the pregnant participants screened and offered to join the program. And at this time, I'd like to ask Jordan Arneson to talk a little bit about the process that she uses to screen and some of the things she might say to the participants. And so let me get out of the, I'm going to turn off the slideshow so we can see each other's faces better. Let's see. Okay. Jordan, are you out there?
Yep, I'm right here.
Oh, there you are. Okay, perfect. All I see is the circles.
Hi, my name is Jordan Arneson. I'm the breastfeeding coordinator for a community action program, and I'm also the nutritionist for the North Country area. So especially in the North Country, there is quite a few pregnant moms that are on a well rather than a public water system. We've been doing it for 3 years now, since we started, and families have been extremely receptive to it. Like you mentioned the tool earlier, before I even see them, I'll usually just look up their address so I have an idea if they are on public water or not, because we still have quite a few people that are unsure if they are. I'll start by introducing the program, and then I kind of keep the kit handy with me when I introduce it, so then I can show them how easy it is and everything they have to do, so they don't have a lot of questions when they go home. I'll explain that the well water isn't as closely monitored or at all, and there is contaminants found in New Hampshire of, like you said, the arsenic, lead, manganese, copper, and uranium. And I'll show them is all they have to run their water for 5 minutes, fill the container up, and then the postage is paid for on their envelope. So all they have to do is drop it off in the mailbox. And I let them know the water is tested for those contaminants. If it's tested and any high levels are found, they'll send over the zero water pitcher, which is rated for taking the contaminants out. Most of the time, families are excited for the opportunity, but if I do get a little bit of hesitation, I'll just remind them of how simple it is. It's free, and it's just helpful to protect their families against some of the contaminants found here in New Hampshire. So one thing I do get sometimes is families will tell me that they do have like one of the Brita water filters, but I let them know that the Brita isn't rated for taking out all those contaminants as well. And just that it's good to know for yourself and your family, especially if you're using that water. So I show them, I send them home with the kit and just the document with more information so they can read it. And then after, I obviously have them fill out the consent form, put the referral in Starlink, and then it's done. So it is really easy. And if anybody has any questions for me, I'm more than happy to answer them.
Yeah, let's open it up to questions. Any questions about Jordan's process, or any questions about the entire presentation or the program? We can open it up at this time. We'll give a prize to the first person who asks a question. No, no, sorry, I don't have any prizes.
Amy, I actually have a question.
Sure.
When a sample gets sent back to you, what's the turnaround time for the testing process?
I would say Lou usually gets the results to me in about a week, somewhere ranging like 3 days to a week and a half, maybe. And then I usually, so for the participant, I would say probably at most 2 weeks, somewhere between like 3 days and 2 weeks. Hi. It's Jennifer. Oh, you just popped up on our. Any other thoughts or questions or challenges or? How are people doing with test kits? I know I just sent some to the Concord office. Do any other of the regions need test kits?
Always
Okay.
follow up with supervisors and coordinators after too, and make sure everyone's well stocked. And if anyone thinks of questions after, feel free to send them directly to us or to your supervisors, and we can make sure we get your questions answered.
And I'm going to upload the, if you'll hang on for a couple minutes, I'm going to upload the 3 documents I just talked about, and I'll put them in the chat so you have them. Just taking me a minute to find them on my messy desktop.
Amy,
Yeah,
can I ask a question?
sure.
All right, great, thank you. I just realized, looking at your slide, that it appears that there's like a 40% return rate, if you will. If if I understand this correctly, we gave out over 100 kits to moms who want to participate in the program, but then only about 43 of them actually collect a water sample and send it back. Is there something that we can do to, and I don't know the circumstances as to why that return rate is only like 40%, but or maybe the people out that are actually out in the field working with these moms, is there something that we can do to up that number? Like you said, I think we've talked about this before, and we see this in any of our private well collection initiatives that we have throughout the state. Is you have to make it as easy as possible for people to do it. And I know we're providing the prepaid mailer so they don't have to pay for postage. But can anybody think of anything else that we could do to help get those numbers up? Aside from actually going out and collecting the sample for them. I mean, that would be the easiest thing, right? I will come to your house and collect the sample. But I can't think of anything else. But I'm wondering if other people have some, or if they've heard feedback from some of the moms that say, yes, I'll participate, but then never send something back.
I can attest to that a little bit. It's very simple to do. I don't necessarily think there's any way that you guys would be able to make it more simpler. I do know a lot of times during certification appointments, when a mom is being certified for being pregnant, it is a very busy appointment and kind of going over benefits and everything else that we go over. So maybe something that WIC staff could do is we do follow-up appointments every 3 months, and we can just kind of check in on that referral and ask them if they've sent the kit in. And that's why, as I explained, when I try to do it, I try to focus on how simple it is, and show them exactly what they do. So all they have to do is go home and do it. But I think we can also follow up when we give them a phone call in 3 months too, and ask if they've sent in their kit yet.
That sounds great. Oh, go ahead, Michelle. Sorry.
I was just going to say that it looks like there's a couple questions in the chat as well, but I'll let you say what you were going to say before.
Well, I see. Yeah, so I see one about the incentive, like a gift card. That's interesting. Maybe if we could come up with some sort of gift card, like if you turn in your sample. Not sure what, but we could explore ideas for that. One thing I have heard, and I'm trying it out with other projects that I'm working with, is telling folks the monetary value of what they're getting. And I've started doing it in advertising for, I have workshops where folks get free water testing for showing up, and I tell them like how much it's worth. So in this case, like if you were to do a water sample at a private lab for these 5 contaminants, it'd be about $100. So, Lou's team charges 85, but a private lab would be more like 100, 120. So it's you could say it's worth about $100. It's $100 value, and then the pitcher you receive is about the pitcher plus filters is about an $75 value. So that might be something to throw out there. But yeah, gift cards is an interesting idea. I was making phone calls to folks that had not sent in their sample within a month or so. And I was doing that for several months, and I actually found that it had no impact. Unfortunately, I kind of tracked, I made this phone call on this date, and then I looked, 2 or 3 months later and saw if the phone call, and it never made any impact. No one ever turned in the water sample after I made the phone call. So, but I think, not to be discouraging, I think if the nutritionists made phone calls, it would probably have more of an impact because they know you, they've met you, and you probably have more trust, more of their trust and more credibilities. Whereas I'm calling like a stranger from, the phone probably says state of New Hampshire or, environmental service. It might not be something that would really, have an impact more, since they meet you all and they have some trust and a relationship. So
Yeah, that's a really great point. Just, remembering to check back at those referrals and see like, okay, we sent this mom home with a test kit at that next appointment. Just really, being like, hey, did you send it in? Do you still have that? Reminding them, just, yeah, absolutely. And then the other question that popped up, which Hannah answered, it was just that, yeah, we'll send out the handouts and slideshow, as well as the recording to the coordinators and directors to get to everybody. Yeah, I mean, if there's any other questions, we have the time set aside that we can chat, but if not, we can give you guys back a few minutes of your day.
thank you for all the hard work you do. It's very important and very needed.